But we begin in India, where authorities have recorded more than 103,000 new coronavirus cases on Monday, the highest daily tally since the start of the pandemic. This brings the national total close to 12.6 million cases. The country has reported more than 165,000 COVID-19 deaths. The situation has forced the country's wealthiest state, Maharashtra, to put its population of roughly 110 million people under weekend lockdown. It's also instituted a nighttime curfew and closed restaurants and shopping malls. Well, the production of the two vaccines approved by the Indian government cannot meet both Indian and global needs quickly enough. So what other options are there? Let's speak to senior clinical lecturer at the University of Exeter Medical School, Dr. Bharat Pankhania. He joins us from Bath in the UK. Doctor, because of the spike in cases in India, Delhi is restricting exports to other countries of the vaccines that it produces. Who will likely be most affected by this?
The countries all over the world who are expecting supplies from India. But the bigger picture here, the elephant in the room that we are still not talking about is the pharmaceutical companies were asked to relinquish their patents to enable new plants to produce the vaccines and give it to the needy countries in the world, and they're refusing to do it. That is the big problem.
What alternative sources are there for countries that were depending on vaccine exports from India?
The alternative sources that will be coming online very soon would be from Russia and China. The United States is using most of its production for its own home consumption, and the Indian government was going to supply. But as we know, vaccine nationalism is alive and well, and we really need to work together to enable manufacture so that the rest of the world can also be immunized.
Yeah, that vaccine nationalism has been a big concern since the very beginning. Does this risk, what's happening with India, does this risk turning the vaccine into sort of a bargaining chip when it comes to international relations?
It is very much so, and we witnessed this in the disagreements between the United Kingdom and the European Union. And we realize this. It is absolutely clear that in the middle of a crisis, people look after their own country because there are political interests, there are political pressures, there are elections in India. So the Indian government is restricting exports. And we knew that these sort of scenarios would play out. Therefore, it is a failing not to enable new plants to be set up, new manufacturing, and persuade the pharmaceutical companies to let go of their patents. We will reward them, we will give them royalties, we will give them license money, but at least enable new manufacture elsewhere in the world as well.
Yeah, we already know that wealthy nations are stocking up on supplies of vaccines far more than they actually need. And we've seen that with, tremendous success in vaccine programs there in the UK where you are and then in the United States. But does this also risk making vaccine inequality more of a reality?
Unfortunately so, and we are seeing that the United Kingdom, the United States are racing ahead with immunizing their population. But, to use the old phrase, we are not well until all are well is very important. So whilst the United Kingdom has been donating a lot of money to the World Health Organization COVAX program, what I feel is really needed is for big hitting countries like UK, USA, European Union to persuade the pharmaceutical companies to relinquish their patents, to work with the World Trade Organization and set up extra additional manufacturing capacity. I think that's the way forward.
Yeah, and as you said, we're not well until we're all well. And I know the COVAX scheme, that's the intent, is to spread the vaccine throughout the poorer countries that don't have capacity to develop these vaccines themselves. But does this shortage of vaccines in poorer nations risk delaying the end of the pandemic? Because we all want the pandemic to be over as soon as possible, but by hoarding these vaccines, does that essentially delay the end of the pandemic?
Not only does it delay the end of the pandemic, but people need to be aware, especially politicians, because the scientists are aware, which is this. if you have uncontrolled, relentless infection going on in the poorer nations, then that is the place where variants will emerge. And if variants emerge which bypass the vaccine antibodies that you have already created in your country, you could be put back to square one. Therefore, it is in the richer nations' self-interest to say, I need to suppress this infection elsewhere. Otherwise, I will go back to square one.
All right, we'll leave it there. Dr. Bharat Pankhania, thank you so much.
Thank you. Thank you.